Olá, muito boa tarde. Muito obrigado aos telespectadores que nos estão a ouvir. O meu nome é Nuno Almeida, eu vou ser o vosso anfitrião em nome da editora Prime Books. Temos o enorme privilégio de ter uma referência nesta área, o Dr. James Di Nicolantonio, e eu vou brevemente passar a palavra, onde ele vai fazer uma apresentação. Vão poder colocar questões ao vivo, portanto terão a opção de escrever e nós veremos as questões e colocaremos em direto. E o nosso objetivo é que usufruam ao máximo de ter um especialista connosco. Vou então ler o currículo e a qualquer momento coloquem questões. Portanto, o Dr. James Di Nicolantonio é investigador e doutorado em farmácia no Instituto do Coração de St. Luke's Mid-America Institute, na cidade do Kansas, no Missouri, e é autor dos seguintes livros: The Salt Fix, Superfuel, The Longevity Solution, e agora da obra, também disponível em Portugal pela Prime Books, A Chave da Imunidade. O Dr. James é um cientista e especialista em saúde e nutrição, internacionalmente reconhecido e um importante contribuidor para as políticas de saúde do Canadá. É autor e coautor de aproximadamente 200 publicações na literatura médica e faz parte do conselho editorial de várias revistas médicas. Já partilhou a sua experiência nos programas da Dr. Oz Show e da Doctors, bem como em meios de comunicação internacionais. Eu vou passar a palavra ao Dr. James, mas aproveito para dizer que, apesar de ser em inglês, sempre que possível farei um pequeno resumo dos pontos essenciais das suas respostas. Portanto, qualquer questão, novamente, coloquem. Dr. James, the floor is yours. Thank you.
Thanks, Nuno. Excited to be presenting today on our new book called The Immunity Fix. And also I'm going to be discussing some strategies that help support the immune system. So really, the Immunity Fix was born out of several publications that myself and some of my colleagues were working on in regards to nutraceutical strategies for boosting the body's own type 1 interferon response against viruses. So we had published several academic papers that were press released on certain supplements that help support the immune system. And I decided to take a lot of that research and put it into a book, which ended up turning into something that was nearly 500 pages, almost 2,500 references. And what's great about this book is it also gives practical strategies, things that people really can take home and take away for supporting their own immune system. So I will be discussing COVID-19 a little bit as well throughout this, but also just, strengthening how we can strengthen our own immune system. Now, when it comes to COVID-19, what I list here is essentially certain factors that increase the risk of dying from COVID-19. And what I highlight in red here are the nutrients that if you are deficient in, what the risk of the increased risk of dying from COVID-19 is. And so the main point about the book here is you can see, yes, if you're older, you're at a higher risk of dying from COVID-19 by about 9.5-fold, but you can't do anything about your age. But you can improve your vitamin D levels. And if you are severely deficient in vitamin D, you are at a 15-fold higher risk of dying from COVID-19. So everything else besides age that you see on this screen is modifiable. You can improve blood pressure, metabolic syndrome, zinc and selenium deficiency. So we are in control of our own health. And really that's what the Immunity Fix is about. And I'll be going over the factors that increase your own and support your own immune system.
Thank you, Dr. James. While you're preparing the presentation, I'll just do a quick recap. Então, o que o Dr. James disse de forma muito resumida é que sobre a nossa idade, que é um fator de risco, de facto, para a Covid-19, não há muito mais que possamos fazer. E, portanto, o que ele vai apresentar é as medidas práticas de suplementos, de hábitos que podemos implementar nas nossas vidas. Dr. James, go ahead, please.
Perfect. The first vitamin I'll be talking about is actually vitamin C. So this is a graph of adults dosing, and in the circles, these are adults, and in the squares.
Sorry, we cannot see. Now you can see it. Thank you.
So essentially, what this is showing is that in adults, 1 gram of vitamin C causes about a 7% reduction in the severity of the common cold, whereas 4 grams causes about 3 times the benefit. So you get a 20% reduction in the severity, and that's in adults. And we see the same dose response in children, where 1 gram leads to a 13% reduction in the severity of the common cold. But if you double that, there's a 26% reduction. And then these dotted lines are what are called linear regression. Essentially, these are the clinical trials. And then this is more of a hypothesis generating line, but we may be able to get a 50% reduction in the severity of the common cold with higher doses of vitamin C. Now we can see the same type of dose response to the common cold with higher doses of vitamin C for the duration. So not just only the severity, but the duration of the common cold is reduced better with higher doses of vitamin C. And so we may be able to get 50% reduction in the duration of the common cold at higher doses that you can see here. So essentially, the tolerable upper intake of vitamin C in children has been set at 1.2 grams per day and adults at 2 grams per day. But as you saw in the previous slides, the optimal intake may be at least double that. And so for most people, the tolerable upper intake was set just because it may cause some diarrhea. For most people, they may be able to go higher without any issues. If you do have kidney disease or oxalate kidney stone formation, you do need to be careful with high doses of vitamin C all at once. Now, the key takeaway with this slide is that vitamin C should really be dosed on a regular basis. And then when you get sick, you need a more of a therapeutic dose, a higher dose. And so if you only take vitamin C when you're sick, but you're very depleted in your overall diet, that will not provide as much benefit. Whereas if you're someone who's consistently consuming vitamin C through diet or supplementation, and then you get sick and you take higher doses, that has been shown in the clinical studies to give more of a benefit. So essentially the takeaway is basically don't just supplement when you're sick. You want to make sure your vitamin C status is good on a daily basis.
Okay, so excuse me. We have a question from Joaquim Ferreira about vitamin C. So he's asking is there any evidence that vitamin C can contribute to prevent or attenuate the symptoms of COVID-19 specifically, and if every kind of every type of vitamin C works, or the studies were done with a specific type of vitamin C?
It's a good question. So two good questions. So I'm not aware of an actual human clinical study that's been published testing vitamin C in people with COVID-19. But that being said, without question, our immune cells take up vitamin C. They use that vitamin C to help for numerous functions. And taking vitamin C also increases the level of immune cells that we have and their ability to kill. So essentially the phagocytosis, their ability to engulf viruses and bacteria, improves when we take vitamin C. But again, we don't have studies specifically on COVID-19. And then the type of vitamin C, the active form is ascorbic acid. Essentially, it's the exact same thing whether you get it through diet or supplement. That's the active form. There are some lipophilic vitamin Cs that are absorbed slightly better. But in regards to, is there a certain form that works and doesn't work? No, because it's the same structure. Synthetic vitamin C is technically the same as what you get through diet.
Ok. I'll do just a quick recap for our audience. Então, o que o Dr. James disse, resumidamente, foi que para a vitamina C realmente ter efeito máximo, deve ser tomado antes, não é só quando a pessoa está doente, mas sim como hábito preventivo. A dose, a tolerância é alta, pode haver efeitos secundários, como diarreia, e a resposta que ele deu às perguntas foi que não há estudos específicos com pessoas no caso da Covid-19, mas a vitamina C, no geral, aumenta a capacidade do sistema imunitário. E não há bem um tipo específico de vitamina C. Desde que tenha o ácido ascórbico, o composto ativo, deverá resultar. Back to you, Dr. James.
Great. So just to recap on the vitamin C, there are studies that indicate that the optimal sort of dose that should be taken daily, and I can't give prescriptive advice, but this is just what the clinical studies have suggested, is around 500 milligrams to maybe 1 gram per day. And usually if it's dosed every 2 to 3 hours. So lower doses more frequently seem to be better. And if you get acutely sick, there are studies showing that maybe even up to a gram every 2 hours for up to 6 doses may be optimal.
Okay.
So going into zinc lozenges, essentially a lot of us know about different supplements, different zinc supplements. So some are in capsules. This is actually lozenges. Both have evidence, both zinc capsules or tablets. Lozenges have a little bit more evidence, but I would say it's probably just because this is more rapidly absorbed. So with zinc lozenges, they should be taken every 2 hours. You typically want to start within 24 hours of symptom onset. And studies have shown that zinc lozenges can shorten the duration of the common cold up to 6 to 7 days, essentially wiping out the complete duration of a common cold if it's taken quick enough and dosed appropriately. And essentially, that means having a daily dose over 75 milligrams. What you can see here is the pH of the mouth is 5, and at that pH, zinc acetate has nearly 100% bioavailability, same with zinc gluconate, but when you start adding glycine to it and other types of lozenges, the bioavailability starts going down. Here are just a summary of some of the studies showing the reduction in the duration of the common cold, with zinc lozenges being between 1.3 and 7-day reduction. This shows why the optimal amount of zinc per dose should be 18 milligrams, because you get this 6 to 7 day reduction if you hit that dose every 2 hours, and just the benefits go down as the dose goes down. So you can see here, this is about 18 milligrams, and as you go down to 10, you might only get a 3-day reduction.
Just a quick recap. So, o que o Dr. James diz é que o ponto ideal parece ser quando se obtém 18 miligramas de zinco de 2 em 2 horas. Back to you, Dr. James.
Perfect. This slide is showing how the daily dose of zinc during acute infections needs to be above 75 milligrams per day. It is important to supplement with copper when you're taking higher doses of zinc, typically in a 20-to-1 ratio of zinc to copper.
Ok. So, em infecções agudas, o ideal parece ser acima de 75 miligramas de zinco, mas tem que ser suplementado também com cobre para que o efeito combinado seja o melhor. Ok. Go ahead. Thank you.
Okay. This is a meta-analysis of randomized control trials testing black elderberry in patients with either influenza or the common cold. And what the study showed was that a standardized black elderberry supplement, so this is standardized to 12 to 15% anthocyanins, and because that's important, a lot of black elderberry supplements are not standardized, or they might just be black elderberry juice powders, which don't really have a lot of the anthocyanins, and it's really the anthocyanins that are providing the benefit. So you want to make sure you're getting a high quality black elderberry. And these studies have shown that it can lead to anywhere from a 2 to 4 day reduction in the duration of either flu or cold.
Okay, just to give the translation of black elderberry. Em português, o black elderberry é o sabugueiro. Okay, thank you.
Mm-hmm. This study was called the NACIS study, testing N-acetilcisteína, which is a way to boost our own cysteine and glutathione levels. Because cysteine is an amino acid that helps us form glutathione, which is a master antioxidant, important for things like inflammation in the lungs and cytokine storm when we're dealing with things like COVID-19. And N-acetilcisteína was tested in this randomized controlled trial, multi-center. I think it was 20 different centers in Italy. Almost 300 elderly patients were enrolled, and N-acetilcisteína was given at a dose of 600 milligrams twice a day, dosed prior to the cold and flu season and given for 6 months. And essentially what we saw was a significant reduction in the severity and incidence of influenza-like illness. It was actually cut in half. There was about a 2-day reduction in the duration of the flu, which was highly statistically significant. So moving on to vitamins. Vitamin D is technically actually not a vitamin, it's a prohormone. We do get it through diet, but we also can synthesize it when the sun hits our skin. 1 billion people globally are actually vitamin D deficient, and half the global population is vitamin D insufficient. And we need to activate vitamin D to something called calcitriol, which is the active form that binds to the vitamin D receptors, and that requires magnesium.
Okay, just one quick question. Even in Portugal and other countries where there is a lot of sun, we still see a lot of vitamin E deficiency. So what might be the reason for that?
I would say the primary reason is because most people are not exposing a majority of their skin to sunlight for a long enough period of time. And secondly, too, as we age, our ability to produce vitamin D through sunlight and skin transformation goes down. But primarily it's because we work indoors. We're typically working during the peak hours of the sun. And then maybe we get outside for a tiny bit, but we're basically our entire bodies are clothed except maybe our face and our hands. So that's primarily why most people are still deficient, even if they live in sunny environments.
Okay, I'll do just a quick recap because that's important. Dr. James diz que, antes de mais, a vitamina D é, na verdade, uma pró-hormona e que 1 bilhão de pessoas no mundo têm deficiência de vitamina D. E é também comum, em países como o nosso, que têm bastante sol, haver também muita gente com falta de vitamina D. E a razão apresentada é que nós apanhamos pouco sol, ou estamos a trabalhar nas horas de pico do sol, ou quando apanhamos sol, expomos apenas parte do nosso corpo, e portanto é importante expor regularmente o nosso corpo à luz solar para ativar. Thank you.
Yep, no problem. So what this is showing you is that we can get vitamin D through supplements, diet, or the sun, and then our liver and kidney have these enzymes that convert vitamin D3 to calcidiol, and then to the active form calcitriol, which is where we get all the benefits. But these enzymes require magnesium. So your magnesium status is just as important as your vitamin D status, because not only does magnesium activate vitamin D, it helps the body move vitamin D around. So it's important. It doesn't really work too well without good magnesium.
It's a key aspect. Just one second. Então, não só o calcitrol para subir os níveis de vitamina D é importante, como só funciona adequadamente com magnésio, porque o magnésio ajuda a este processo e ajuda a distribuir a vitamina D pelo corpo. Tal como há bocado falámos, da mesma forma que o zinco precisava de cobre para funcionar adequadamente, a vitamina D necessita de magnésio para funcionar também adequadamente. Thank you.
What this graph is showing is you have vitamin D levels here, and this is the season, and then this is the incidence of the flu. So we've known for a long time that as we get into the months of October, November, December, our vitamin D levels drop and the cases of influenza go up in an inverse proportion. So while this is not causal data, it's highly significant because it shows that the incidence of the flu tracks with vitamin D levels in an inverse. So as our D levels go down, the incidence of the flu goes up. And as the vitamin D level rises, again, the incidence of the flu goes down, and then it basically ceases April and May.
Yeah, so causation and correlation are not the same, but there is a big coincidence, let's call it that way, right? So
Right.
I'll just give this brief explanation. O Dr. James está a dizer que há, de facto, uma relação de maior situações de gripe nos meses que têm menos sol. Não é prova de que isto seja a causa, pode apenas ser uma coincidência, mas é uma coincidência curiosa que, de facto, quando produzimos menos vitamina D, seja a altura em que há mais gripe. Thank you, Dr. James.
Welcome. Now, actually looking at clinical studies in humans testing vitamin D, we see benefits with vitamin D supplementation. So essentially, this was a meta-analysis of 11 placebo-controlled trials in almost 6,000 patients, and vitamin D supplements reduced the risk of respiratory tract infections by over a third. And if the individuals were taking vitamin D on a daily basis, it actually reduced this by 50%. So once daily dosing of vitamin D seems to beat out once a week. Now, what about vitamin D in COVID-19? We do have some both correlative studies and causal studies, so I'll go through both. So we see that severe COVID-19 patients, almost 83% of them are actually deficient in vitamin D. People who have a vitamin D level of less than 20 nanograms per ml versus those who have higher levels above 55 are twice as likely to test positive for SARS-CoV-2. And then compared to people with good levels of vitamin D that are sufficient, those who have D levels less than 30 have a 2 to 3-fold higher risk of dying and are twice as likely to have a poor COVID outcome. And if someone is severely vitamin D deficient, where they have less than 12 nanograms per ml, they're at an almost 15-fold higher risk of dying and a 6-fold higher risk of having a poor COVID outcome. This was actually a clinical study testing asymptomatic or mildly symptomatic patients with COVID-19. And these individuals were deficient in vitamin D at baseline, and they were given 60,000 international units a day for 7 days. And if their D level was still below 50 nanograms per ml, the vitamin D was continued for another 7 days. And essentially the people that got,
can you back up 2 slides? Okay, so we had a question from Madalena Silva, and she was asking, when you mentioned that the daily dose can be better than the weekly, what do you mean by that exactly?
Essentially, people who take vitamin D as a supplement on a daily basis seem to have a greater reduction in the incidence of respiratory tract infections versus people who only take it once a week.
Once a week. Ok. I'll answer that in Portuguese. A pesquisa demonstra que quem toma regularmente, ou seja, uma vez por dia, tem melhores resultados, toma vitamina D, isto é, tem melhores resultados do que quem toma a mesma dose uma só vez por semana. And just, can you move to the next slide, just to give a brief... you're seeing the presentation? Okay, just a second. So just to give a brief recap, o que aparece neste slide é que, coincidência ou não, na verdade, 82% dos pacientes hospitalizados por Covid tinham deficiência de vitamina D. E à medida que as doses, os níveis, neste caso, de vitamina D no sangue vão diminuindo, vemos aqui um aumento do risco de morte. Portanto, parece haver pelo menos uma correlação, mesmo que não seja uma causa. Thank you, Dr. James.
Yep. So back to this, this was a randomized controlled trial in patients with COVID-19. This was called the SHADE study. And again, essentially these asymptomatic or mildly symptomatic patients were either given a vitamin D or not. And people who were given vitamin D, 3 times as many people ended up testing negative for SARS-CoV-2 by day 21. So this study is suggestive that vitamin D may help us clear the virus quite faster. Other promising interventions in COVID, calcifediol, which is sort of a partially activated vitamin D analog, has been shown to reduce the incidence of having to go to the ICU if you have COVID-19. So you can see only 2% ended up in the ICU if they were given calcifediol, which again is this partially activated vitamin D analog. And whereas 50% of people had ended up in the ICU who did not receive that. Glutathione as a supplement has also been shown to rapidly improve COVID-19 in people who have difficulty breathing. Other supplements that may have benefit are alpha-lipoic acid, and we discussed N-acetilcisteína as well. Alpha-lipoic acid in a clinical study, it hasn't been published yet. It's a preprint at 1,200 milligrams per day, cut COVID-19 mortality in half. That just missed statistical significance. And then there is some data that melatonin may have benefits as well. One study showed that people who supplement with melatonin are at an 83% lower risk of dying. Melatonin supplementation has also been shown to reduce the risk of testing positive for SARS-CoV-2 by 30 to 50%. And there was a case report of 10 COVID pneumonia patients. They were given a total daily dose of 36 to 72 milligrams of melatonin, which is a higher dose than typically you're only given maybe 3 milligrams before bed. But this was in divided doses. So they gave essentially maybe anywhere from 10 to 20 milligrams, essentially 4 times a day. And that was shown to reduce the hospital stay in those COVID patients by 5 days. None actually required mechanical ventilation or help for breathing, whereas people who did not get melatonin, 26 to 40% of those COVID patients needed mechanical ventilation, and no one died in those 10 individuals that were given the high dose melatonin, whereas similar cases that were hospitalized at the same time, there was a 20 to 35% risk of dying.
Yes, so we have 2 questions from people that are watching, and while the questions pop up, I'll just say something to our viewers. A glutatione, em Portugal é glutationa, desapareceu, mas eu tenho aqui os nomes, não tem problema. E o outro é o ácido alfa-lipoico. Mas eu vou passar a pergunta para os nossos ouvintes. Portanto, ora, pronto, em relação a... Okay, so the question from Rosario Abreu is if regarding vitamin C in cancer, do the professionals still prefer the non-acid version, and if there is some grounding for that? That's the question, and then the second part is I'll let you answer the first one so that you won't get lost. So, was I clear?
Yeah, I don't think that there's any advantage to having like a buffered form of vitamin C. Just any type of vitamin C has been tested. I've never seen any advantages of going with like a buffered type of vitamin C to reduce.
Ok. Então, quanto à primeira parte da pergunta, o Dr. James diz que não há vantagem, ou pelo menos ele não tem conhecimento de nenhuma vantagem na literatura ou lhe tenha chegado de outra forma a haver a versão não ácida, ou seja, com o buffer. Vou agora fazer a segunda parte da pergunta. The second part of the question is that do zinc supplements should always have magnesium, or you should only add magnesium when the zinc supplement contains 75 milligrams?
So you don't want to take zinc at 75 milligrams in one dose. Typically it's dosed at about 20 milligrams, and you usually balance that with about 1 milligram of copper. Yeah, magnesium doesn't have to be, usually taken in that type of rate. It's really copper that is needed for zinc.
Okay, so can you just, so it's usually dosed at 20, right?
Yes, zinc is usually 20 milligrams, copper 1 milligram, usually 2, maybe 3 times a day.
20 milligrams zinc, 1 milligram copper, right?
Right.
Ok, I'll answer em português. O Dr. James diz que, na verdade, não costuma ter muito interesse dar doses de 75 miligramas de zinco de uma só vez, e que tem mais interesse dosear em doses de 20 miligramas, e que a importância do magnésio para o funcionamento do zinco não é relevante, mas sim o cobre. Portanto, a proporção que se costuma dar é de 20 miligramas de zinco para 1 miligrama... Sorry, 1 milligram of copper or 1 gram of copper?
1 milligram, typically.
Ok. Pronto. Então é 20 miligramas de zinco para 1 miligrama de cobre espaçadamente. O magnésio não precisa ser tomado conjuntamente. Ok. Pergunta seguinte dos nossos ouvintes. Next question. Just 1 second. Okay. So, what is the ideal daily dose of black elderberry?
Typically, black elderberry has studied been between 600 milligrams and 1,500 milligrams per day.
1,600 and?
Between 600 milligrams and 1,500 milligrams.
Ok. A dose diária habitual costuma ser entre 600 miligramas ou 1.500 miligramas, a dose diária. Ok, we can proceed. Thank you.
Yep. Other promising supplements are selenium. So even in people who have adequate selenium status, there have been several clinical studies showing that giving 200 to 300 micrograms per day enhances our own immune system. And then there's this really classic example of how being deficient in a mineral like selenium can lead to worse viral outcomes, that being something called Keyshawn disease, which if you get something called Coxsackie virus, which is an RNA virus, it typically doesn't cause much issue. In some children, it causes hand, foot, and mouth. But if you are selenium deficient, it ends up causing Keyshawn disease and cardiomyopathy, which can kill you. And these people are typically treated with selenium. So it goes to show you that if you are nutrient depleted, we as humans do not do as well when we get viruses. The other potential promising supplement is something called quercetin. That's been tested in one study at 500 milligrams twice a day. And that was shown to reduce the incidence of upper respiratory tract infections in cyclists.
Ok, just a quick recap. O que o Dr. James está a dizer é que qualquer deficiência em minerais tende a comprometer, nem que seja de uma forma mais leve, o sistema imunitário. E dá aqui o caso do selênio e explica o problema e porque é que 200 a 300 microgramas, muito importante, não é miligramas, é microgramas por dia, aumentam a capacidade adaptativa do sistema imunitário e que a quercetina, dada 1000 miligramas por dia, reduziu significativamente as incidências de infecções respiratórias em ciclistas durante 2 semanas de exercício intenso. Back to you. Thank you.
Yep. So this is a food pyramid that we have in the book, The Immunity Fix. And the reason why we have both animal foods and plant foods is because they provide different nutrients. So eggs, meat are high in selenium, B12, iron, zinc, and protein, bioavailable protein. Whereas your plant foods are higher in magnesium, potassium, manganese, boron, things like that. So consuming both plants and animal foods does provide you a better overall nutrient status. And you get the antioxidants too and polyphenols with olive oil, raw honey, coffee, and obviously minerals as well are important for our own antioxidant systems and how we handle viruses. And liver is very important as well because liver is a good bioavailable source of things like vitamin A, copper, molybdenum, and other nutrients that we really can't get through plants.
Just a quick question. In looking at the immunity system food pyramid, let's call it, is there any risk that by trying to improve our immune system, we're creating other kind of imbalances? No?
Not in the way that we have laid it out in the book. So it is important that you don't overstimulate the immune system, but through diet, that's typically not an issue.
Ok, just to give the answer. Eu perguntei se ao seguirmos esta pirâmide alimentar com o objetivo de melhorar a imunidade, não corríamos o risco de criar outro tipo de desequilíbrio noutro funcionamento, noutro problema existente. E o Dr. James respondeu que se for feito de uma forma, como ele explica no livro, passo a passo, seguindo os valores e de forma cuidadosa, não haverá esse risco. Ok, thank you.
So it's really these foods, the processed foods, the inflammatory oils that are causing people to have not only their immune system is not working as well, but this creates inflammation, which can drive, inflammatory cytokine storms. Sorry,
this happens. We see this everywhere. Inflammation. Can you just give a brief explanation of what is this systemic inflammation?
Sure. So essentially, when we consume these processed foods that are high in sugar or high in omega-6 seed oils, it damages the intestine, and then things can start leaking through that shouldn't be, and our immune system gets overactivated, and our immune system starts secreting inflammatory cytokines. So really, when we say inflammation, it's really an overactivation of our immune system secreting inflammatory substances.
Ok, thank you. I'll give the recap. Eu perguntei pela questão da inflamação. Nós ouvimos falar da inflamação no corpo, mas o que é que isso significa realmente? E o Dr. James respondeu que certas coisas que comemos acabam por danificar o intestino e permite que certas coisas passem que não deviam passar. Isso, por sua vez, obriga o sistema imunitário a ficar hiperativo e a secretar também substâncias em excesso. Thank you.
So when it comes to diet, it's important to get the optimal intake of all nutrients. So in the book, we do discuss why having about 12 ounces of red meat is important, because it hits the RDA, or the recommended dietary allowance, for iron, B12, zinc, and protein. And then 2 times a week to replace about 6 ounces of that red meat with things like wild salmon or seafood, lobster, crab, to boost your omega-3 intake. And then things like cod liver oil as well are great for increasing vitamin D and vitamin A. Getting these blends of ground meats that also contain organs like liver and heart to give you nutrients in liver that I had discussed before, like folate, vitamin A, and copper. The heart has CoQ10. Pastured eggs, so not your conventional eggs, but eggs from chickens that are free range, that will have higher amounts of antioxidants, lutein, zeaxanthin, and higher amounts of minerals. And then getting in dark greens, cruciferous nuts for magnesium, potassium, berries and camu powder for vitamin C. If you are more of a plant-based person, that's fine. Things like beans should be combined with wild rice to sort of get you that more bioavailable, complete protein package. And if you are consuming whole grains, they should be unrefined.
Okay, just to a brief interruption, we have a question. I'll just ask Jaime to launch it. From Maria Rosa. And I'll do a quick recap while we're waiting. No, there's the question. So Maria Rosa asks if is there a strong link between stress and immunity, and if so, what are the best practices and supplements to fight off stress?
Yeah, stress does release something called cortisol and corticosteroids, which inhibit our body's own production of type 1 interferons, which is how we fight viruses. There are supplements that have evidence in people who are stressed. The most evidence is probably ashwagandha, which is an Ayurvedic herb. Usually it's dosed at about 200 milligrams per day. That's something that has been shown to help with stress. There's also things like other herbs like tulsi, also known as holy basil, which has some evidence too and for helping with stress.
And any practices non-supplemental, for example?
Yeah, I mean, I think having more of a positive mindset versus a negative mindset helps handle, because we need to be able to deal with stress. So all stress is not bad. It's really how you deal with it internally. So if you can figure out how you can handle a stressful situation and not overreact to it, that's really the best way to train your body to handle stress.
So reframing and practices like meditation, yoga. I mean, is there any kind of practice that helps dealing with stress?
Yeah, there's definitely studies where meditation, yoga, listening to books on tape can kind of bring down people's stress level. Breathing techniques, breathing out and holding the breath for a few seconds, breathing out through the nose, in through the nose. Those are some strategies that may help with stress.
Ok, so brief recap. Há de facto suplementos que são referidos no livro e as dosagens. Os nomes aqui não, ou seja, não estão traduzidos, portanto poderemos depois responder os nomes especificamente ou apresentar uma lista, mas há que equacionar também de forma muito importante as outras práticas, como pensar de outra forma, meditar, práticas respiratórias. Portanto, é uma conjunção, é uma combinação entre suplementos e práticas. Thank you, Dr. James.
So the importance of salt in immunity is threefold. In order for us to get the benefits of the food we eat, we have to be able to digest it well, which means we have to have good stomach acid. And how we form stomach acid, or which is called hydrochloric acid, is from chloride combining with hydrogen ions. And we only get chloride through salt. Salt is sodium and chloride together. So people who go on low salt diets have been shown to have less acid in their stomach, which could lead to less nutrient absorption. So by having a normal salt intake, that gives us better stomach acid, we digest our food better and absorb all of our nutrients better. And the acid also helps to kill pathogens that are coming through the diet. Now, the body also directly uses chloride from salt to actually kill viruses. Our white blood cells secrete something called hypochlorous acid, which contains chloride. And then the body has the opposite effect in regards to once the immune system has sort of killed off the pathogen, it secretes something called taurine chloramine that helps to reduce the inflammation. And the chloramine is chloride. So we need salt because we cannot synthesize salt. We need to get it through the diet in order for us to have sodium and chloride in order to fight infections. And the other importance of salt is the exogenous topical uses of salt. So gargling with salt water has been shown to improve sore throats, reduce mucus, and kill pathogens. Inhaling salt has been shown to break up mucus in the lungs, improve breathing and immune function. And then nasal irrigations, right? Using sterile water, neti pots with these salt solutions. There's been many randomized control trials that using those type of nasal irrigations may help fight respiratory tract infections. And there are systematic reviews and meta-analyses showing that the studies show that it may help with chronic rhinosinusitis and allergies.
Okay, we have a question from the audience. I'll let Jaime put it out. From Pedro F. Okay, so Pedro asks, what is the ideal daily dose of salt?
So that's a good question. So there's sort of two different things that I can say. From a general population standpoint, the prospective studies looking at urinary salt release, which correlates with intake, indicates that somewhere between 1.5 teaspoons around that amount seems to be optimal for the lowest risk of cardiovascular disease, deaths, regarding all-cause mortality. But people's salt intake needs to be very individualized. If you eat a higher potassium magnesium diet, you can tolerate more salt and you may be able to consume more. If you have low amounts of potassium and magnesium, you tend to retain more salt. So really it depends on the two other minerals. Are you getting good amounts of potassium and magnesium? Then you can handle normal amounts of salt. And then of course, if you're someone who loses salt through sweat or drinking a lot of coffee, you need more salt.
Okay, I'll give the Portuguese answer. O Dr. James disse que é uma pergunta curiosa, tem variações, mas por norma, digamos que 1,5 colher de chá de sal parece ser a norma. Mas tudo depende se nós consumimos mais potássio e magnésio. Nesse caso, seremos capazes de tolerar um bocadinho mais de sal. Se consumirmos menos, conseguiremos tolerar menos. E se fazemos mais exercício ou suamos mais, também conseguiremos tolerar mais. Thank you, Dr. James.
So fasting is sort of a trend that's been taking off recently, and there are benefits to both what are called intermittent fasting, where it's just more like time-restricted eating. So you're still eating in a day, but it's just in a shorter window. And then there's something called prolonged fasting. And really, how fasting, most people benefit from it is either skipping breakfast or skipping dinner and just eating 2 meals per day in regards to improving blood sugar and cholesterol levels and things like that. And then some people who are very severely obese seem to have some benefits if they do more prolonged fasting, either 1 meal a day or maybe a 2-day fast every month or so. But there are risks, obviously, to fasting as well. So it's that tight balance of figuring out a way to restrict the time period that you're eating, but also not losing muscle mass and things like that. Now, exercise is another double-edged sword, just like fasting. Too much exercise can be harmful, but actually having a moderate amount of exercise is beneficial. So the studies show if you're someone who moderately exercises at a fairly decent intensity, maybe 3 to 5 times per week, the studies indicate that may reduce the risk of an upper respiratory tract infection by up to 50%. But if you're someone who's over exercising, training almost every single day, over an hour at a very intense pace, that's stressful on the body, and that can increase the risk of an upper respiratory tract infection. So it's, again, this tight balance of you want to move and you want to be at, moderate intensity, but being at a high intensity for too long can be too much stress on the immune system.
We have two questions from the audience. I'll just let them show up. So the first one, let's see. Okay, we have one from Jaime Abreu regarding fasting. So is it healthy for people who suffer from diabetes to implement fasting, and how is it done differently?
So it depends on the person. If someone who is diabetic is eating 6-7 times a day, then simply reducing the number of times that they eat has been shown to have benefits on blood sugar, insulin sensitivity, and things like that. If you're someone who is severely overweight, then more prolonged fasting may be needed sometimes to sort of really improve insulin sensitivity. So instead of maybe eating 2 times a day, maybe just once a day may benefit those individuals.
But for example, for people who suffer from diabetes, how could they start testing this in a way that didn't represent extreme risk, let's say?
Right. And that's the thing you got to be careful too, right? Because you're on medications typically if you're diabetic to reduce blood sugar. So when you start improving your insulin sensitivity, you may not need as high of a dose. So you can drop someone's blood glucose too low if you just start fasting and you keep the doses of your medicine on when you're diabetic the same level. So you really have to work with your doctor always.
Okay.
Any type of fasting regimen.
Okay, I'll just do a recap for this and then move to the next. O Dr. James disse que para diabéticos, dado que muitas vezes estão com medicação, este trabalho tem que ser feito em conjunção com o médico, porque às vezes, ao começar a fazer jejum e aumentar a sensibilidade insulínica, a própria dosagem vai ser alterada. Portanto, isto tem que ser feito em conjunção com o médico. Vamos passar à pergunta seguinte. Next question. Okay, so João P. Silva asks, what do you consider moderate exercise? And second part of the question, when we are sick, should we do anything? Is there something that we can do, or everything is off limits?
So what I consider moderate exercise is typically 30 to 45 minutes of jogging pace, or getting your heart rate up to about what would occur when you're jogging.
Okay.
Whereas high intensity would be something typically where you're almost sprinting and you're doing that for an hour or more per day.
Okay, and that's the time of the session. And how many times a week, every day?
Usually 3 to 5 times per week is probably optimal.
And the second part, when we are actually sick, should we do, for example, let's say stretchings? Is even stretching not good for our immune system when we're down? Is there anything? Let us know.
I don't think stretching would harm the immune system if you're sick, but you typically don't want to be exercising and taxing your immune system when you are sick.
Okay. Recap. Quando o Dr. James fala em exercício moderado, ou seja, para obtermos o máximo possível da boa relação entre o exercício e o sistema imunitário, porque excesso de exercício é agressivo para o sistema imunitário, é uma agressão. O que ele considera exercício moderado é algo que levante a nossa frequência cardíaca acima do normal, um bocado o passo, como quando fazemos jogging, certo? E sentimos um elevar da respiração, mas nada que nos deixe completamente incapazes de manter uma conversa. E cerca de 45 minutos, uma sessão de 45 minutos, 3 a 5 vezes por semana. E quando estamos doentes, não há bem uma grande vantagem em fazer qualquer tipo de exercício. Eu dei a sugestão, por exemplo, de alongamentos. Ele disse que não é bem um problema, mas o ideal quando estamos doentes é realmente permitir ao corpo restabelecer-se e recuperar. Thank you, Dr. James. I'll just move. Is this your last slide?
This is the last.
No, sorry. Keep going. Yeah.
So sauna has a long history for cardiovascular benefits, relaxation, and now there's this immune aspect to increasing the body's core body temperature. So the first response to an infection is a fever. So the body will actually raise its core body temperature, and it does this for a reason. One of the reasons is viruses do not replicate in the body as well when your core body temperature is higher than normal. And number two, when the core body temperature increases, it releases something called heat shock proteins. And those help to, they have antiviral effects. They literally reduce the replication of viruses. So there's been many prospective studies in humans that people who go into the sauna 3 to 5 times per week are at a lower risk of influenza, pneumonia, the common cold. There's even a human clinical study showing that going into the sauna several times a week may reduce the incidence of the common cold by up to 50%. So we know from these human studies and even animal studies, if you throw them essentially into a sauna before you give them a lethal pathogen, they have much less mortality. So heat is sort of a weapon against viruses. But the other double-edged sword is that when you actually have an active fever, that's a contraindication to then boosting your core body temperature because you've already done it. So this is something more of like I can't say a preventative, right? But it's something that you do on a consistent basis rather than, okay, I'm sick and I already have a fever and jumping into the sauna. That's not what you want to do. There's these other benefits too with sauna in regards to it helps sweat out toxins, POPs, which are persistent organic pollutants, BPA, flame retardants. We can kind of release these harmful substances through sweat. We talked about heat shock proteins having these antiviral benefits. There's this mood and stress benefit of sauna. It's relaxing to be in a warmer environment. And then it is important, though, to replace salts and electrolytes and fluid after the sauna session.
Okay. I think we have questions already from the audience, but first, in a way, sauna kind of simulates the fever of our own body, right?
Correct. Yes, it's a way to mimic a fever.
Ok, I'll just do a little translation. O sauna e o calor, tal como a febre é uma resposta do nosso sistema imunitário para criar um sistema, digamos, pouco propício aos vírus. A sauna replica isso e cria uma cascata de efeitos químicos que faz com que o ambiente seja menos propício à instalação dos vírus. We'll go with the questions now. We have one question. Let me just...
Hello, olá, tudo bem?
Olá. And then no, just one question, and then I'll introduce Alex.
Okay.
Okay, the last question before introducing Alex. Lopo Cancelo de Abreu asks if CBD, so the CBD has any proven effectiveness regarding immunity, and if so, do you already use it or recommend it?
I personally do not use CBD. I haven't seen any studies in humans that there is any benefit, but that does not mean that there is not.
Ok. Só para responder esta pergunta, pessoalmente o Dr. James não utiliza, não viu nenhum estudo a falar na sua efetividade, não quero com isso dizer que não exista. Ora, quero também dar as boas-vindas ao nosso autor Alex Gomes e vou fazer também uma introdução ao Dr. James. Dr. James, we have a special guest with us. He is also an author of Immunity, and he's just joining us to give his input, his questions, and I'll pass the word to you, Alex. Thank you.
Okay, muito obrigado. Hello, Dr. James. It's very nice to have this opportunity to make you these questions face to face. So, eu vou fazer a pergunta em português e depois eu faço em inglês, tá? Para testar o meu inglês também.
Vamos a
Então,
isso.
a minha pergunta é: qual é o maior inimigo? Qual é o maior inimigo da nossa imunidade? Se é uma má alimentação, se uma vida sem descanso, por onde o doutor acha que a gente deveria começar a fazer alterações? So, Dr. James, my first question is, which one do you think is the worst enemy of our immunity right now? So bad eating habits, the lack of rest, lack of sleep. Where should we start?
That's a great question. I think where we should start is first eliminate the harmful substances that you're consuming on a daily basis. So that would be the inflammatory omega-6 seed oils like corn oil, safflower oil, soybean oil, highly inflammatory. They get into your immune cells and increase the release of inflammation. And then the refined sugars as well. And so that's probably the first easiest step that people can do to sort of reduce the inflammation in their body and improve, help support their immune system.
Okay. So we can start with taking a lot of care of what we eat, right?
Right. Yep. Start with the diet.
Yeah. So my second question, I'll ask in Portuguese, then I'll speak in English. Se o doutor acha que nós vamos aprender a lição após esta pandemia, se estaremos mais atentos aos nossos hábitos e como isto influencia a nossa imunidade depois dessa experiência. So, Dr. James, do you think that we are going to learn our lesson, that after this pandemic, we are going to take a lot of care of our habits, or when we all get our vaccine, we are going to think that the world is good now and we live as we lived before?
Yeah, that's a great question. I think a lot of people are just hyper focusing on, okay, get the vaccine. But there's going to be many other viruses that we're going to have to deal with. And having poor metabolic health is directly going to determine whether you do well against any type of virus or not. So really the focus should be, how healthy are you? Not only the hyper focus on get the vaccine, because even different strains of coronavirus are showing up, and the manufacturers of those vaccines have indicated they're not sure if it will have protection against those different strains. So what people can do is eat healthy, exercise, get good sleep. That's ultimately going to determine your own health, your own immune health, and that really should be the focus. And then vaccine should be sort of like a secondary discussion.
Okay. Very good. So those were the two questions that I have prepared, but I am very I can't wait to have the chance to read the book, and I want to thank you for this kind of information that I personally think that is very needed right now. Because what I think is that we are losing our good habits, we are losing our way into making more harm to our body than the other way. So thank you, Dr. James, and I let you with Nuno.
Thank you, Alex. Just this is a good place to start wrapping up, and I won't keep you too busy, and I'll just do a brief recap for our audience about the last two answers very briefly, and then we'll close the session. So, para Portugal, as perguntas, ou melhor, as respostas, porque as perguntas também foram feitas em português. O Dr. James respondeu que, obviamente, temos de tomar vários cuidados, ou seja, exercício, alimentação, mas que a melhor forma de começar é eliminar coisas que danificam muito o sistema imunitário, nomeadamente certos tipos de óleos, açúcares refinados e, portanto, tomar cuidado com o que colocamos no corpo. A segunda pergunta é se vamos aprender alguma coisa com os bons hábitos ou se estamos apenas à espera da vacina e depois vamos voltar aos nossos velhos hábitos. E a resposta foi que, independentemente de haver vacina, a nossa imunidade vai sempre depender do nosso sistema metabólico e do nosso sistema imunitário. Portanto, não há volta a dar e quanto mais cedo adotarmos as boas práticas, melhor. Dr. James, I'll think in Portuguese and then I'll think in English. O que eu vou dizer ao Dr. James, basicamente, é isto. Eu quero agradecer porque num tempo em que se fala de muitos problemas, de um cenário um pouco de pânico, por vezes faltam respostas concretas daquilo que podemos fazer. E não respostas de opinião, e sim respostas baseadas em ciência e práticas, ou seja, exercício, suplementação, nutrição. E, portanto, este é o tipo de discurso que deveria ser mais frequente para podermos ter mais conhecimento e assim nos protegermos melhor. Portanto, muito obrigado, telespectadores. Espero que tenham gostado. Eu vou só agradecer ao Dr. James e encerrar a sessão. Dr. James, just to wrap up, I was just telling the audience that in this time where all media just shows horrible news and bad things happening all over the world, we are forgetting about the importance of having solutions, of having practical applications, and not just only based on opinion, but most importantly based on science. What people should be looking now and in the future is for answers like, what supplements should I take? What kind of exercise is best? What food should I be avoiding? What foods? So I want to thank you because this is what is needed to move forward with health now and forever. So thank you very much. And if you have any last words, please feel free.
Yeah, I think you touched on it very well. It starts with our diet, and we are in control of our own health. So we want people to know that as well. So there's light at the end of the tunnel with this, and I think we can learn a lot from it. And so if we take a positive mindset to this, I think we can be better off as a population.
Thank you very much, Dr. James. It was a pleasure. I hope to have more of these events soon. Who knows? And we all enjoyed tremendously your book because, like this interview, it provides with very practical information, and I'm sure everybody that gets your book will be pleasant surprised and left with a very practical approach to solve the problem. So thank you very much. It was my pleasure.
Thanks,
Hope you had fun too.
I did. Yep. Thank you.
Ok, thank you. Bye bye.
Okay.
E muito obrigado, audiência. Até breve. Vejam o livro no site da Prime Books, noutras plataformas, vejam e informem-se, porque a informação é realmente concisa, concreta e vai direto ao assunto. Muito obrigado. Bye. Thank you.